News 46. Local coverage you can count on.
Are you on Medicare, have special needs, or are you losing your doctor? Please, let me help you. Call me, Fred Nelkin, for your free consultation. 751-3744, right here in Pahrump.
Women's health is very key. When you talk about women's health, you have to speak of the younger ladies. And let's talk a little about that. Typically, young women, they should come to see us if they're not getting birth control pills, at least at age 21, to have their first pap smear and pelvic exam. It's important for those ladies to start out early so they can have those good, healthy habits going into their mature years and senior years. And the old ladies is very important. I think they get confused that I'm not having a cycle, I don't need to see a GYN doctor, but it's very important for those ladies to come to see us because we do pelvic exams on them, looking for skin cancer on the outside of the private area, look on the inside as well, and also do a detailed pelvic exam, make sure there's no tumors inside. And more importantly, they all should be doing self-breast exam. And I'll tell most women starting age 21 or older should be examining their breast at least once a month. And this is what's key about that. They're looking for changes. If they start when they're very young and feel the same little lump that's been there for years with no changes, then that's great. But any changes, they need to come seek some professional help.
And you have a little chart of different lumps and how much they can change depending on if you're doing a regular exam compared to what it says is by accident, which is actually a very large lump. This is so important. It's life-saving information. It's something that people, mothers need to talk to with their daughters, women need to talk to with their doctor, find out how to correctly do a self-breast examination.
When you see your provider, we have a breast care program at Southwest Medical, and they can always stop by the one that we have at Rancho in Las Vegas to get information or ask their primary care doctor for it. It's very important to start because when you present to me with a lump, it's often about 2 or 3 centimeters in size. Yeah. When you find something that's changing, it's better because the smaller lump, the less aggressive the tumor may be, and of course, the sooner you get in for treatment. So it's very important for women to educate their young kids on how to do the exam. And one thing that's important, you should do at least once a month. You should do it several days after your cycle, if you haven't cycles, because the amount of water retention in the breast is much less and you get a better exam. You can examine your breast in the shower, you can examine your breast, lying flat on the bed. And also, if you have a partner, sometimes the partner is the one who will find these lumps and alert us to those. So it's very critical to examine your breast once a month. If you're a mature lady and not having cycles, then you may want to set your calendar once a month, the first of the month, to do your breast exam and look for changes.
And for more information, they can get in touch with Southwest Medical Associates, and they can even come and see you, can't they?
Absolutely.